And I'd just like to thank Cathy one more time for sharing her story. I've seen that so many times. And it's just so moving, and it doesn't matter how many times I see it. So I guess just to get started, I'd probably direct this question to Janine and Cathy in the first instance.
Good morning. And thank you for coming to listen to our presentation today. Really appreciate your attendance. I guess the first thing is that I was involved in the Barrett process, I guess from the very beginning, from when the announcement of the closure was made. And I guess I'd be fairly generous in describing the attitude and process of consumer involvement as consumer containment. And the process that we've had to date since the Commission of Inquiry and working on the implementation of the government recommendations has really given a legitimate opportunity for carers and consumers to contribute their opinions and thoughts and really given validation to the needs of the young people that need these services. It's really given an opportunity for us to raise really significant issues for this particular patient cohort of young people with severe and complex mental health issues. And that has, to a degree, previously been ignored or certainly not addressed to the extent that it needs to be. And you can see that, Cathy is a shining example of what is possible. And I guess that this process has kind of given us hope that through meeting the needs of these young people, that there'll be a whole lot of young people who might have otherwise fallen through the cracks or not received the treatment, or their time to recovery has been unnecessarily extended by not getting the appropriate treatment, so that they can fulfil their potential and hopefully have, happy lives where they are contributing to society and able to, meet their own goals. I guess just the third thing I'd quickly like to say is that it's really given us a platform to also expand the conversation beyond the Barrett issue. It's no secret to the people from Queensland Health that we, have other issues that we'd like to address, and that's looking beyond just the extended treatment facility. That treatment facility has to be integrated into the youth mental health system. And in order for that to work effectively, I think we also need to look at other areas within that system to make sure that all of those areas are working really effectively and doing what they need to do for the young people that access those services. And the other point I think that's been really important is that we've actually been able to have conversations and I believe have some influence at the executive level. Myself and Cathy and another carer consumer and consumer are on the steering committee, and on that steering committee sit the Deputy Director General as our chair. We have John as the Executive Director of Mental Health Services in Queensland, other Deputy Director Generals from Education, people from the Premier's Department. So it's a very good platform for being able to have those people, and they're the people that decide on budgets, locations for services, really important decisions at high level. And I think we've really been able to have an opportunity through being on the steering committee to access that level of Queensland Health and those other departments to really try and inform and improve the awareness around what the needs of this particular patient cohort is.
Would you echo that, Cathy? What's it been like being on a steering committee with such high-profile, high-level public servants?
It's been mildly intimidating at times. I think there's no way to get around that. But I feel like everyone has done their best to make us feel welcome. I've never at a steering committee meeting felt like that my voice was not appreciated or not heard, which has been fantastic. And as part of this process, consumers and carers have also been encouraged to attend pre-briefings, which I think has been fantastic. It really helps us get up to date and sort of understand what's going to happen at the meeting so that we can we know what's going on and we can voice our opinions.
So maybe I'll direct this to John and to Stacey. Can you maybe give us some, for the people in the audience who don't have context, maybe describe some of the processes where consumers and carers have been involved in this project from the different perspectives of health and education?
Thank you. So Stacey from Department of Education. I think for us it's been an exciting opportunity to collaborate collectively around the needs for our students, and that's what we're here for. It is around that continuum of care in ensuring that our students are catered for in the best possible way they can. I don't think I've been a part of a more exciting project and facilitation of great workshops around what that looks like at every level, from workshops right through to steering committees, through to us meeting individually with parents at schools around what this means for their students in their particular context.
Look, thank you. It's great to be back in Townsville, and thank you very much for all coming out today. To me, it's a continuation of a process that we started a long time ago that got lost in this particular thing, where people should have that particular input and do it. The two good things about this one is that, yes, we have to say, and we've had everything on the table, which is good. The second is that it's not just the representatives in the room, but we've had an opportunity to reach back into community, into grassroots, and actually get that feedback. Because if you think about the way that consumer movement has worked for me in the last 30 years, it's always been about everybody having one way of getting that input in, not just the voice of a few. And so I think that's been a really important part of this process.
So just to give everyone some context, one of the recommendations is specifically around developing a new service that would be located at the Prince Charles Hospital for young people with severe and complex adolescent mental health issues. As part of that, there have been some workshops around the actual design of that facility, which Gunther has been very involved with. Gunther, has there been... Have you experienced some shift with the process of having consumers and carers involved? What's been beneficial about that? There you go.
There's been an enormous change in our design development actually through this process. First reason, there was actually no benchmark, no example somewhere else in Australia or even globally. We found one actually that's currently under construction in Canada that has a lot of similarities, but there was nothing really to start from, so that made it very difficult for us. So this co-design process really allowed us to reach very deep into the operational requirements, into the therapeutic requirements, and also the day-to-day requirements, and then safety overlays, etc., of this facility. And it gave us a very wide platform. Traditionally, this engagement goes to clinicians and nursing staff and therapeutic staff, and very little with the consumers. And in this platform, we could throw it indeed all up on the table. We literally did. We had the drawings out on the table. We moved people around. We moved parts of the buildings around. And we did that through a process also of getting informed. So it wasn't us kind of going out, this is what we cooked. You know, one that we made earlier, what do you think about this? It was a genuine process of actually trying to understand what the needs were. And to date, I still say, if we didn't do that process, we would have designed a very different facility, and it probably wouldn't have been definitely not as therapeutic as that facility could be for the patient. So to us, it's made an enormous difference, and I'm hoping that it will make a huge difference for the patients and the users of that facility in the future.
Mm. So Kathy and Janine, would you recommend, you've had this involvement over some period of time now, from September last year or even beyond that, would you recommend it to other young people to get involved as consumers?
Absolutely. I think my message would be, I think we need you, essentially. The process has been incredibly rewarding for me to sort of feel like that hopefully that what I'm doing will hopefully make a significant difference to people that were like me 13 years ago. And that's sort of what drives me and keeps me going. I feel like my main weakness as a consumer is that ultimately I am one voice, and I can only really provide a personal perspective of one story. So I feel like although that I do my best to advocate for other people's stories and advocate for other people's wishes and opinions, I certainly didn't live their experience, and I don't feel like I can tell their story or tell their opinions or perspectives as powerfully as they potentially could. In this process, it has been really difficult to get other consumers involved, particularly surrounding like the consumers of severe and complex mental health issues that have are in and around the past 5 years. Often they haven't had really positive interactions with health services, health staff. So they've been very difficult to engage, and unfortunately my generation that have suffered from severe and complex mental health issues in the past 10 years, often we just don't really know where these people are now. So it's been very difficult to get consumers involved. And certainly to anyone out there that sort of is thinking of doing something similar and is wanting to get involved, I'd sort of say, I think we need your voice.
I'd definitely reiterate Kathy's comments there. For a lot of young people, if they've had a negative experience, or even if the journey has been so difficult and they are now in recovery, a lot of young people want to close the door on what's come before that and are reluctant to get involved. The other issue is that some people are still in recovery and they may not be well enough to actually engage in this process. So through Health Consumers Queensland, with their support, we're looking at, trying to find the ways that we do get access to that consumer voice. But in terms of the value of young people who might be reluctant to be involved, I guess I could give a really quick example of being in one of the model of service design workshops. And we had a service provider, we were talking about referral pathways, so how young people may actually get referred to this service. And this particular service provider said, oh look, it's really clear they need to come through this agency, everything needs to come through this agency. That's the way we will be able to monitor and make sure referrals are appropriate. And in our group we had a young person who'd actually had a very difficult time with her mental health over a very long time, and lots of very significant damaging issues. And she said, well, I see your point, but in my experience, I had a really bad experience with that service and disengaged. And so that doesn't mean that I don't need the help, but I'm not going to get it if you're saying that you're the only place that I can obtain a referral to this new facility. And after explaining her story, the service provider actually said, you are absolutely right. And I agree. And it totally changed the conversation and the approach and the attitude. And that wouldn't have been possible if that young person hadn't actually been able to provide that direct experience and contribute that to the conversation. So I guess it's so powerful for people who are delivering the services to actually hear what it's like for the young people that are on the receiving end of those, and some of the difficulties and challenges that they face. So yeah, definitely young people need to be involved. As a carer, I can represent my own experience as a carer and pass on, as Kathy said, you do your best to pass on and represent other people's stories. You can communicate other people's stories, but it's so much more powerful when it comes directly from those people.
So similarly, for the development of services, whether they're health services or education services, what would and this is for the three people on the end, what would be the things then that would be the most coming out of consumer and carer engagement? What would be the things that have been most beneficial, I guess, about having consumers and carers at the table in that process?
So from our perspective, our students really needs to be at the centre of all of our decisions around that. And so being able to talk directly with their families, being able to talk directly with students around what really made the difference. So what was it that actually allowed our students to succeed or not succeed? And we need to learn from that. And it really is our decision to be very committed to ensuring that our students' voices are heard also around what educationally will help them be successful in their future lives for that absolute continuation and continuum of education and care.
Look, from my point of view, there's a couple of things. One is the notion of recovery, people actually taking control of their own lives, getting some say in what happens to them and being autonomous. And this is part of that, having that voice of recovery in there all the time, because we have to do that. The second thing is that it really accelerates change. One of the things is that when you have that face-to-face confrontation with the stories and you deal with people at a human-to-human level, you actually can really melt away some of that resistance and culture change. 'Cause when people go to work, they go to work to try and do good. They just need to find better ways to do more good. That's basically it. You know, they're not trying to be difficult. I think Catherine's story is a really important one to show that you can think you're doing something with the best intentions and it's really, of course, not very good at all. And so you need to have that constant reframing of that model and the accelerated change you can bring with that. And the other one is really quite powerful politically. I mean, it actually gets the money, it actually gets the notice of the politicians, and it gets people like me to do stuff. And I think that if I look over the successes that we've had over the years, it's been when we've had that proper partnership and proper voice. And I think about the stuff in Townsville all those years ago, that it was about a community having some kind of say when they didn't have a say before. And that's really, really important.
And keeping on that note, and maybe Gunter, you want to pick up on this, has it been different having consumers and carers, and you touched on a little bit, but right from the beginning, so not presenting something that's kind of already half done, but right from the beginning, what's been has the benefit from your perspective?
Look, it has reset a lot of thinking about certain aspects of space for us. There is guidelines and there's stuff that's been done before, and traditionally as architects you grab what is in a guideline and you listen to you and you kind of repaste it together and off you go, and through this process it really kind of made us aware like a lot of this is actually wrong and is no longer relevant, and we had to actually go back what I call to basic ergonomics, basic understanding what is actually happening in these spaces and how that space actually needs to support that. So we actually had to depart a lot of the guidelines, a lot of the stereotype drawings, and start again with a blank sheet. And it's interesting because, I mean, hopefully I'm only halfway in my career, but you've been doing this almost like for half of your career now, this copy-pasting, and it's not just copy-pasting, but interpreting. And because actually we need to go all the way back again, because things have changed so much in general in healthcare as well, that models have changed, people change, cultures change, and we actually need to reset the clock on a lot of these things and actually go and dig deep again to make sure that we're actually not creating another white elephant. You know, that would be the worst thing that we could be doing, that we are investing all this money, and that it would be a major missed opportunity, not just for the facility, but for those patients as well. So that has really been the resetting of the clock for me and also for my practice now, that we're saying, well, actually we need to take that opportunity to dig deep, and that's sometimes hard because, things are on a process and on a timeline, etc., and there's a lot of, but I think with well planning, and this one has been very well planned, I think, by every party that's been involved, and also the willingness to contribute the time as well, both from the carers and the consumers, and also from the staff, etc. And that is very important, and that's made the big difference, I think.
So we do actually have a few minutes in order to be able to throw some questions to the audience. So